operation theatre and anesthesia technology. Today we are just going to see about a case presentation on the topic tibial fracture. So tibia is basically located in our lower leg, which is medial. Okay, so it is actually present in the medial aspect of our body. What is medial? Towards the midline. Okay, so actually tibial fracture is a common injury that occurs due to various mechanisms, like which includes road traffic accidents, falls and sport injuries. And also this tibia is known as shin bone. Okay, it is a weight bearing bone in the lower leg that plays a crucial role in mobility and balance. A fracture in this bone can lead to significant morbidity and impact daily activities because it is a weight bearing bone. So today we are going to see about a tibial fracture case presentation. So let's start with Sandhya.
Persons with a history of a road traffic accident, complaining of severe pain and swelling in the lower leg. The patient was a passenger in a car that collided with another vehicle, and he was unable to bear weight on a 30-year-old male present with a history of a road traffic accident, complaining of severe pain and swelling in the lower leg. The patient was a passenger in a car that collided with another vehicle, and he was unable to bear weight on the affected leg. Immediately after the accident, age 30 years, sex male, occupation office worker, mechanism of injury road traffic accident, complaints severe pain and swelling in the lower leg, medical history no significant medical history, no allergies, social history non-smoker, occasional alcohol consumption.
Gopika, can you explain about the clinical features of this patient in this case?
Clinical features. The patient presents with the following clinical features: pain and tenderness in the lower leg, swelling and bruising, deformity or abnormal mobility, limited mobility of the ankle and knee joint, neurovascular deficit. Check for pulses, sensation and motor functions. Skin inspections. Checks for open wounds or compromised skin.
Next, Madhu, can you explain about the investigations in this case?
Yes, ma'am. Investigations. To confirm the diagnosis and assess the extent of the injury, the following investigations are ordered. X-ray, AP and lateral view. To confirm the fracture and assess the alignment. CT scan. To evaluate the fracture pattern and plan surgery. MRI scan. To assess soft tissue injuries. If suspected, blood test. To rule out any underlying medical conditions.
Can you also tell about the diagnostic test for this case?
Sure. Diagnosis. Based on the clinical features and investigation result, the diagnosis is a tibial fracture, AO/OTE classification 4-2 to B2. Thank you.
Good. Vigneshwari, can you tell about the treatment plan for this fracture?
Yes, ma'am. Treatment. The treatment plan involves the following steps. Step 1. Initial management, immobilization with the splint or cast. Pain management with analgesics, example NSAID, opioids. Elevation and ice application to reduce swelling. Monitoring for compartment syndrome and neurovascular deficit. Step 2. Surgical treatment, open reduction and internal fixation ORIF with plates, screws or nails. Closed reduction and external fixation if soft tissue compartments. Intraoperative fluoroscopy to confirm the reduction and fixation. Step 3. Post-operative care. Monitor for compartment syndrome and neurovascular deficit. Early mobilization and physiotherapy. Follow up with the serial X-rays to assess healing. Wound care and suture removal.
As well as the complications in this case?
Management. The management plan includes conservative management, immobilizing with a cast or splint, pain management, regular follow-up, surgical management, ORIF or closed reduction and external friction, post-operative care and rehabilitation, remobilizing and physiotherapy, strengthening exercise and gait training, return to sports and activities. Complications. The potential complications of tibial fractures include compartment syndrome, neurovascular defect, infections, non-union or delayed union, malunion, post-traumatic osteoarthritis.
Good. We know what is the prognosis of this case.
The prognosis for the tibial fracture is generally good with prompt and appropriate temporary treatment. However, the outcome may be influenced by the factors such as severity of the injury, patient complaints, and underlying medical conditions.
Sandhya, can you give the summary of this case presentation?
Yes, ma'am. Tibial fractures require prompt diagnosis and treatment to prevent complications. A thorough history, clinical examination, and imaging studies help diagnose the fracture. Treatment involves immobilization, pain management, and surgery, followed by post-operative care and rehabilitation. Thank you.
Good. So in this class we have seen about the case presentation on the topic tibial fracture. Where you have learned about the etiology, clinical features, and then diagnostic tests as well as investigations, and also we have what to say, conclusion we came with the diagnosis that it is a tibial fracture.